It's my pleasure to introduce to you Catherine Ma, MD, FRCPC, PhD. She's a scientist at the Center for Addiction and Mental Health and head of the Food Policy Research Initiative at the Ontario Tobacco Research Unit. She's an assistant professor in the Division of Public Health Policy at the Dalai Lama School of Public Health and affiliated faculty at the School of Public Policy and Governance at the University of Toronto. Dr. Ma is currently leading several CIHR-funded projects, including a study on ethical principles that inform policy debates on food advertising to children, and the policy analysis component of a research program in health and health equity to study interventions to address household food insecurity. She's engaged in research partnerships with Toronto Public Health and the Toronto Food Strategy, and is a member of the Toronto Food Policy Council. So, welcome, Catherine.
Thank you, Ashley, for that introduction, and thank you, Sumi, for inviting me to give this presentation today. Welcome, everyone. Today's talk, first of all, I wanted to thank very much all of you for coming today, and also to a few individuals that have really assisted my thinking in this area. So the first is Rebecca Hasdell, who is a PhD candidate at the University of Toronto and the Dalai Lama School of Public Health. And secondly, as was mentioned, I do a lot of work with the Toronto Food Strategy and Toronto Public Health, which you'll see in some of the examples later today. And I'd like to thank Brian Cook, who's a research consultant with the Toronto Food Strategy. So what I hope to share today is all of you who have come to this webinar have a great interest and passion for food policy issues. So what I'd like to do is to offer you an update and on some of the theory and the recent literature in terms of frameworks that might assist your work, as well as thinking through the level of policy influence that local public health actors really have in making change in food and food systems. So the first area that I'd like to talk about is a great new book by Tim Lang and Jeff Rayner out of the UK. And they introduce a new model of ecological public health that I think has really inspired me, and I think would be really valuable for all of those working in food and nutrition policy at the local level. Some of the really interesting pieces of this book are that it's very historically grounded. So for anyone who is teaching in public health or nutrition, I think this is a great new resource that you might want to draw on to bring forward some of the historical issues, which I'm going to do today. The second piece is looking at the variety of paradigms that are currently operating within public health. We often talk about how public health is divided into different silos, but the interesting piece about this book is that it introduces the concept of different paradigms that are operating in public health and may need some resolving as we move forward to some of the really pressing emerging challenges for food systems, and more broadly for population health. So really, the concept of ecological public health, which I'll define later, is rooted in an idea of transformation and transition. We know that we're at really a moment of change in societies and in food systems that is of a scale and intensity that is different than it ever has been before. Transformations in food production, but also distribution and our social environments, and finally in what we consume. So many of you are familiar with the concept of the nutrition transition, but Lang and Rayner talk about a variety of additional transitions that have an impact on our work in public health and population health, as well as health promotion. These are listed here. So I'm just going to highlight a couple of them in particular today. The first one that I'll highlight is the demographic transition. This can probably be best described as thinking through issues not only around population growth or aging, but really three factors: fertility, mortality, and migration. These three are issues that have a great impact on not only the way that our food systems are shaped, but also our individual food choices and our broader well-being. Another transition that I'll highlight that is of great interest is the urban transition. So this is not only a matter of urbanization within the context of broader globalization, but also an acknowledgement that in urban settings, which are now home to over half of the world's population, there is an increasing change or change in dynamics in terms of our social lives, our cultural lives, the way we engage with different settings in which we live, work, and play. So I'm alluding to the built environment, but also place in terms of transportation and layout of our cities, and more importantly for food systems, that interrelationship between urban, peri-urban, and rural areas. So I know that many of you on the call today are from across Ontario, and I think that the urban transition is best seen not only as a matter of importance for people who live in cities, but as something that is a dynamic representation of cities and outside cities as well. The third transition I'll highlight, and that is highlighted in the Ecological Public Health book, is the nutrition transition. So this is the one that most of you would be most familiar with in terms of how we as societies have come to eat a greater variety of food, which is often seen to be a positive thing for human health, but that also this variety of food has also been of increasing caloric intake, increasing sugar, salt, fat, and increasing meat intake as well. This is a transition that has happened worldwide and has resulted in a change not only in our current health status, but also our prospects for the future in terms of rates of obesity alongside food insecurity in other places. So this nutrition transition is again a dynamic situation that is not only about dietary intakes, but really about changes in our social lives, in the environments, and in the way that these environments and social aspects influence individual and population health. The fourth transition that I want to highlight before I move on to the definition of ecological public health is the democratic transition. So this is not only about democratic societies or societies transitioning to democracy, but the idea that within this process of democratization has been a redefinition of what it means to be a citizen, to participate in policy. And I hope that I'll be able to highlight a little bit later how public health practitioners at all levels and all dimensions of public health are actually very much involved in policy activities, whether or not we see it as an explicit within our mandates. So what is ecological public health? Lang and Rayner define this as transforming the relations between the material, biological, social, and cultural aspects of life. As I mentioned before, what's different about this ecological public health model, as opposed to some of you may be more familiar with social ecological thinking, is that this is not only about the impact of those environments on health, so looking from outside to inside with humans at the center of this thinking. Rather, it's about a series of very dynamic and complex transitions that are happening across our material worlds, within our biologies, in our societies and between societies, and also in cultural dimensions in terms of our daily lives and the settings in which we live. This is also different from the eco-health model, which is often talked about in terms of the relationship between humans, animals, and environmental health, in that it really acknowledges to a great deal that important piece of social norms and cultural transitions that anyone working in food is very highly aware of, but is of importance for all of public health. So essentially what the ecological public health model calls for, even moving beyond a social ecological model, is a paradigm change. What is a paradigm change, and how is it going to happen? So a paradigm change, this notion is probably most famously discussed by Thomas Kuhn, and in political science by Peter A. Hall. What they both talk about is that there are multiple orders of policy change that are required in order for a broader paradigm change to happen. Peter Hall, in particular, talks about 3 orders of policy change. In the first order of policy change, what we see is a shift in policy instruments. So this might be our existing taxes or our existing regulations, and then tweaking those in order to better suit changing needs. Second order policy change is about thinking through different policy instruments, so adding new regulations where there weren't before, or using vouchers or incentives in place of other policy levers. Third order policy change, however, which is required for broader paradigm change to happen, is a shift in policy ideas. And again, I allude to what I introduced earlier in terms of social and cultural change. We talk about in public health the necessity of social norms being altered in order for us to enact broader changes in individual and population health. And in political science models, this is also what is necessary for a paradigm change. So what are some of the prominent paradigms that are active today and can be incorporated within the model of ecological public health? Lang and Rayner talk about 4 different paradigms that are currently active and can be reconciled within the broader ecological public health model. The sanitary environmental, the biomedical, the socio-behavioral, and the techno-economic. All of these paradigms are rooted in different parts of public health history, but as I'll introduce a little bit later, none of these problems have gone away, and that is actually really the crux of what is the complexity and the challenge, but also the opportunity for public health as we see it now. So the sanitary environmental paradigm is of course rooted and most accurately represented, I think, in the last part of the century in the transition to safer food. Essentially, this movement within public health was concerned about industrial food alteration and the presence of microbial threats. The second paradigm, biomedical public health, is often talked about in terms of the relationship between physicians and patients. But I think within food systems, this can be more broadly thought about as the rise of models of biology that we needed to engage with in order to improve population health. So in food and nutrition, this was really about the rise of nutrition science, so that only if we could come up with sufficient understanding of our biologies or of better ways to produce foods, we could improve our health and protect our future well-being. The third paradigm is the techno-economic, and in food systems this is most accurately represented in the post-war productionist paradigm. The techno-economic paradigm talks about how economic growth is important for public health, and it is. But the counterpoint to this focus on economic development was also a productionist paradigm, as dubbed by Tim Lang and Michael Heisman in an earlier book, that emphasized quantity of production to feed a growing population. The fourth paradigm that's active in public health is the socio-behavioral model. So embedded within the socio-behavioral paradigm is the social ecological framework that many of you are familiar with, and I think that is quite prominent as an idea in public health. However, the socio-behavioral model really has two or three sides, actually, that I'll talk about. The first is the idea of rational and cognitive thought. Individuals within the socio-behavioral paradigm understand, develop a knowledge base to which they develop attitudes, to which they develop behaviors that improve or are a detriment to their health and also at the broader population level. So this is the idea of informed choices and healthy choices, which is very prominent in public health today. This is an important model for public health, and it was really something that helped us to develop also the notion of supportive environments, so that if individuals were to make informed choices, it was recognized that broader environmental changes needed to happen to support those choices. But the darker side of this, perhaps not the darker side, but the flip side of cognitive models of healthy choices is the notion of governance of the self, or governmentality, which has been increasingly talked about in the postmodern public health literature. And this talks about the idea that at the same time that we are enabling individuals to make healthy choices, we as public health also need to be aware of the possibility of that shift in responsibility to individuals away from others who might have a responsibility also to protect and promote our health, such as governments. So all of the paradigms that I've discussed so far are rooted in public health history, but I think the point at which we're at right now is a challenge and also a situation of complexity, and why the ecological public health model is increasingly needed. None of these problems that we've talked about within each of the paradigms have gone away. So essentially what we need in public health is a way to reconcile the four paradigms together, to, so to speak, cross silos in the way that the existing paradigms are built into our public health standards, practices, structures, and policies. So for example, the sanitary environmental model lives on in our approaches to environmental protection and food safety, the biomedical model in communicable disease control efforts, and also in the role of chief medical officers in local public health. The socio-behavioral model in traditions such as healthy public policy, health in all policies, and healthy cities movements, and non-communicable disease prevention. And finally, the techno-economic paradigm in some of the public health standards, and also as a critique, the notion of social marketing, which some scholars have looked at as a co-optation, actually, of public health to promote commercial marketing practices. So I think this leaves us in a quandary. And ecological public health has promise in helping us find a way out. But what does this really mean in practice at the local level? So this is what I'm going to talk about in the next part of the talk. And the examples that I'm going to use are from the last decade in terms of food policies and food strategies, and more specifically, some of the work that's being done at the Toronto Food Strategy as an example that I'm very familiar with. So local authorities have become important again. This isn't a view that's held widely by everyone, so I want to make that caveat there. But it is an emerging theme, not only in the academic literature, but also a lot of the NGO literature that's emerging at the international level. And what this literature says is that not only local government, but local health departments and local actors. So by extension, I draw this to all of you working at the local public health level, that local authorities have a role, have a leverage, and have an importance that perhaps exceeds what might be interpreted at face value in existing mandates, standards, or structures. What do I mean by that? So, as I mentioned before, the idea that local authorities are important is not some...
Welcome to Go To Training, online training made easy. There are 73 other callers on the call.
Are also as well. And so this picture here alludes to the recent Drummond report that came out in Ontario. What's important at the local level? Well, policy levers. What is a policy lever? Policy levers is not a new but increasingly prominent way to talk about policy instruments or policy tools. The old way of talking about policy levers was about the roles of government. So the toolbox that government had at its disposal to enact change. Things like money, things like initiating programs and stopping them, things like exhortation, rulemaking, stewardship or compass setting, and even things like surveillance, monitoring, measurement, statistics. So these are the tools within the traditional toolkit of the public sector or of government or of policy. But what I want to emphasize to you today, and I hope that you'll take forward into your practice and your policy activities, is a concept that has become very important to me over the last few years involved in this work. And this is that policy decisions are made every day. So the question is not whether public health has a role in enacting public policy to protect and promote the public health, but rather that policy decisions are going forward. So what are we as public health going to do about it? The literature and the frameworks that I think are most helpful for public health here is the emerging literature on policy levers.
Welcome to Go To Training, online training made easy. There are 73 other callers on the call.
Than the existing levers that we're used to having at hand. This is the report that's on the screen here is a recent report actually issued at the federal level by Policy Horizons Canada. And in this report, they talk about 4 types of policy levers, all of which I think are very important to public health. They are aspects of co-creation and network governance, the idea that policy actors are not only those who are in political office or in formal policy roles, but in communities, in non-governmental organizations, in practice roles. The second one is innovation and experimentation. So this idea that experimentation and testing of novel ideas is going to be increasingly important for us as we move into the future. The third one is the notion of behavioral change. And this, again, alludes to some of what I was talking about earlier, not only as an individual matter, but as something that can happen through the right type of insight and information environment. Fourthly, the fourth lever that is highlighted in this report is the issue of the dynamic change interface between what's happening at the local and the global level. So what do I mean by these four dimensions? I'll highlight some of the examples here. So in terms of collaboration and network governance, I highlight the Ontario Public Health Standards, where partnership and collaboration is one of the key pillars or principles that roots everything that we do in public health. But the notion of co-creation and network governance perhaps goes even beyond, or can be interpreted beyond what's embedded in the existing Ontario Public Health Standards. So a great example of this is, I think, at the Toronto Food Strategy, the Community Food Skills and Employability Pilot, which crossed boundaries not only within public health to deliver food handler certification and training between food safety and nutrition personnel, but also involved other city department staff in looking at employability factors that also influence people's life skills and their employment prospects in communities. The second lever is innovation and experimentation, and again, this is also not new to public health. But increasingly can be thought of as a way to develop and test models that seem promising, that it is okay to develop innovation or to think about models such as social enterprise that may be increasingly important for public health to not necessarily only take the lead on, but also to enable other actors in the policy environment to work on. The third lever is behavioral change through insight and information. Alluding to what I talked about before in terms of the social behavioral model, this is not only about creating supportive environments for individuals' choices, but about changing social norms around the information and the inputs that are available to all kinds of people in making their health decisions and really in living their lives. So a great example of open access data that's happening in Toronto right now, for example, is the Wellbeing Toronto website. So this is something that those of you who aren't familiar might wish to look at later. And it allows anybody, it's a public access website, to look at and combine various indicators about neighborhood well-being across the city of Toronto. And this is the type of interface. We know that that publicly available data is being used increasingly in all sorts of creative ways by citizens, by public health units, and also by NGOs. So this is increasingly the new way to think about behavioral change through information. Behavioral change through information is also very near and dear to me in thinking through menu labeling. So I've been involved in some research on menu labeling with Toronto Public Health, and in looking at some of the examples of menu labeling that have happened in other jurisdictions, most prominently in New York City, I think the idea of behavioral change through insight and information goes well beyond this concept of providing sufficient information for healthy food choices. The most compelling part of the example of the New York experience for me in terms of menu labeling was actually what happened in the legal battles that they went through in the initiation of this regulation. So for those of you who aren't familiar, New York City enacted a menu labeling amendment to its health code in December 2006. It was approved by their Board of Health. And essentially what the original amendment said was that the city would require all all food services establishments who already voluntarily provide publicly available nutrition information to make this more available to people, more obvious through labeling, through calorie posting on menus, menu boards, etc. The New York State Restaurant Association, however, raised a legal challenge to this original formulation of the bylaw on two grounds: on preemption and infringement of commercial free speech. So their suit originally was actually successful. But in late 2007 and early 2008, what New York City did was actually to reframe and rewrite the original menu labeling bylaw, or bylaw amendment. And what the new regulation required was for all food establishments of a particular size, in this case it was with 15 or more establishments nationwide, to disclose nutrition information at the point of sale on menus, menu boards, and in drive-thrus. Why this was different and why this second formulation of the legislation was successful and was later upheld in court, in contrast to the first legislation, was that the first one talked about the municipality as being an intermediary between a higher level legislation and what was being done on the market. In essence, substantiating nutrition claims that were already being made publicly available by food businesses. However, the second form of the legislation really spoke to local authority over restaurants in order for them to make information more transparent. And municipalities within the New York City ruling were allowed to do that. So that very, it may seem like a subtle distinction, but I really think it's increasingly the way that at the local level we need to think about our role in behavior change and the information environment. Fourthly, the dynamic change interface between local and global is always been evident in terms of food. And increasingly what we're seeing in food systems work is that localities, not only urban environments, but also rural areas, are finding opportunities to talk to each other without going through higher levels of government. And this is evident in movements such as local governments for sustainability. We're seeing it in climate change movements such as the C40, where megacities are getting together to talk about what they can do collectively and to learn from each other in terms of climate change. And more recently, we dealt with in a symposium that I hosted at the University of Toronto between Japanese and Canadian researchers and decision makers on food systems resilience in the two countries, reflecting on the 3/11 disaster in northeastern Japan. So I hope what I've been able to highlight is really that it is not only a matter of local governments interpreting their own mandates, but that local governments and local public health authorities are already doing so much. The question is how we can begin to learn from each other from the collective local experiences. And examples from, for example, this Institute of Medicine report on local government actions to prevent childhood obesity, which was released in 2009, are things like influence over retail outlets, restaurants, community access, public programs, workplaces, nutrition, breastfeeding, water, zoning, transportation, and marketing. So these are not only settings, but there are also different ways about thinking about the levers that are already active and can be leveraged. So levers and leveraged at the local level. So this is also illustrated in this diagram from the Toronto Food Strategy, which was developed when the strategy's original report was released in 2010, and it illustrates all the ways in which Toronto at the municipal level is already involved in food and nutrition and the food system. So I think the important lesson here is that local health authorities in carrying out food and nutrition work are a platform. They are a platform for engagement of a variety of stakeholders, whether they lead or enable other initiatives to happen. Public health has had a tremendous convening power. And in the food strategy, for example, in a paper that I wrote for international planning studies that will be coming out in the next few months, some of these mechanisms, which highlight some of the new levers that I've talked about, are things like framing, reframing of public health issues, brokering relationships between different types of actors, leveraging existing roles, structures, mandates, and resources to cultivate new space for deliberation and change. So while a lot of the emerging literature on local authorities for public health came out of the obesity prevention literature, I think increasingly what we're talking about is public health has a convening power that also has been alluded to in terms of food. It's been argued that food has a convening power. It brings people together. It touches social, cultural, biological, and material aspects of our lives, but public health does as well. And in this way, I think that the ecological public health model can really inform and inspire what we do at the local public health level to enact healthier and more sustainable food systems for all.
Thank you very much, Catherine. We'll open it up now for questions. We would just ask that you use the chat function on the bottom of your side panel. So if you have any questions, now is the time to go ahead and ask.
I think maybe if it would, with the audience's permission, just so that we don't sidetrack away from Catherine's excellent presentation, is to defer the NRC questions after the questions related to Catherine Ma's presentation have been answered, and then we will get on to the NRC questions. So if that is all right with everyone, it looks like people are probably taking a few minutes to write down a few questions. I have a question for Catherine in the meantime. I was particularly struck by your comment in terms of one of the levers is around innovation and experimentation. I heard a comment once, and I've actually heard it a few times, and that is Canada is like the wasteland of innovation. We love experimenting, but I guess what I'm wondering about is how do we move beyond innovation at that local level, and how do we get something that's really good and move it kind of broadly across the province in Ontario?
Well, I think, Sumi, you've highlighted one really important observation, which is that innovation is already happening. Every time I speak to someone in a local public health unit about food, there's innovation happening already. So there are increasingly, I think the thinking is that we need, what the structures we need are structures that help local innovators to convene. So those types of network structures, such as local governments for sustainability, some of the networks that I was talking about in terms of climate change, networks that are action-oriented.
We still don't see any questions coming through.
I have a few more questions.
Okay.
We can keep talking until somebody writes something if they wanted to.
I should have also mentioned at the beginning that, as you'll have noticed, there isn't a great deal of, or we won't be posting these slides because they're mostly images. But if anyone's interested in particular resources that I mentioned, you're more than welcome to email me at catherine.ma@utoronto.ca, and I'd be happy to send you some of the specific papers or reports that I mentioned today.
Okay, great. Thank you, Catherine. I guess another question I have, until someone writes another question or writes a question, I'm just curious about the fact that I do find municipalities have perhaps, if I may, and we won't comment particularly perhaps about Toronto, but I do find that there is that opportunity at the local level to be a bit more creative and innovative around local policy issues related to food, for instance. And I just wonder if there is a risk or a disconnect between, you know, the fact that something very innovative, very ahead of the curve is happening at the local level, and meanwhile, provincially, those structural supports, policy or otherwise, are not really in place. And I wonder if you could comment on that at times.
Well, I think that this is also a matter of the province beginning to think through all of the local experiences as innovations and examples that can be drawn together into larger lessons for the province. So that's one aspect addressing what you're talking about there. But the second aspect that I don't want to gloss over is that even in this conversation about innovation and networks and you know, informal action, I don't want to de-emphasize the importance of formal things like regulation or those types of new structures or government departments or laws or regulations. Those are existing tools that are often needed to be able to change the environment such that local innovation can happen. So in the example of, for example, local food work, you know, the question is always whether, you know, do we have enough for a local political endorsement or a provincial political endorsement? And I think the question here is about rethinking what lessons can be learned from that experience and what can be done outside the political endorsement, and then specifically what aspects of that action would be most benefited by a reframing at the political level.
Why don't you read it up for her?
Sure. We've had a couple questions come in. So we've got the first here from Lynn Roblin, and she's asking, how can this ecological public health model impact the work being done on the Ontario Food and Nutrition Strategy to move from strategy to actions?
Lynn, thank you for this excellent question. And it is actually something that I've continued to think about. I guess my sneaky way of getting around this question is that the ecological public health model is a framework. In fact, it's perhaps one of my critiques of the model itself, is that by the time I finished reading the book, I was very inspired, but then I thought, now what? So I think it's a matter of thinking through the framing of ecological public health and what public health can do amid complexity, and then applying it at the strategy level. So what this means is that it's about rooting actions in that framing of ecological public health, but also taking action and then seeing what happens. So to allude to those ideas of innovation and experimentation, it is important to take the action and then reflect upon what's happening as it's rolling out.
Great. We have another question from Joanna Lawson. So she's asking, what is your view on subsidies of healthier foods by taxing processed fast foods for funding due to current due to current problem that healthier foods are often harder to access due to price?
So thank you for that question, Joanna. You've raised also a very important question here, but what I'd like to do in thinking through how ecological public health can help us with this question is that questions of food access, as I'm sure everyone knows on this phone call, are about price, about affordability, about income in the first place, about social environments, about access, about geographic access as well. So these two policy instruments are often situated against each other, and I think actually that that's a step in the right direction, because what it is it's linking two pieces of this broader conversation about food access and healthy food availability. But again, it is only two pieces of that broader picture. So I think it's a step in the right direction, but what it leads me to do is ask what other policy instruments can then be linked to these two policy instruments that are proposed in thinking about the broader impacts.
Okay. Any more questions from the audience? Sumi, do you have?
I do have more questions.
Okay, well, we'll take another one from Sumi, and if you have any more, just go ahead and put them through the chat function.
I think, Catherine, this question kind of brings us all the way back to when I first met you and wanted to meet you, and the question is evaluation of policies, their impact. Can you give me an update in terms of where we are with that? What is the status around evaluation of policies, especially around food policies or healthy eating and nutrition policies? Where are we right now? Where do we need to go?
So in terms of evaluation of policies, I think that there's a number of dimensions that we need to think about. Again, because we're sort of in a framework and model mode today in some of the presentation, I'll highlight, of course, the developmental evaluation approach by Michael Quinn Patton, which is often seen as a way to think about evaluation within a complexity context. So that's a great book and a great resource for anyone doing public health evaluation at the local level. But I think the other point that I wanted to make in response to that question is about effectiveness. Often we talk about the importance, and I guess really embedded right in the public health standards is that first question of whether interventions have an impact and what they are. And I think what it's incumbent upon us, if we were to take an ecological public health model, is to think about the broad range of impacts and also inputs that go into our evaluation models. So this is a conversation about different types of evidence. So that we're seeing, for example, in the menu labeling experience, a variety of types of evidence being generated about its effects. So rather than highlighting effectiveness, what I'd like us to do is think about effects, because that is the other piece of unintended effects. And I think that's actually a much more rich conversation about evaluation for public health interventions.
So are there any other questions? Because I do have a kind of an add-on to that, and that is, so because I suspect, I certainly am not by any means an expert in policy nor in evaluation, but I suspect there is an issue when it comes to policy evaluation or evaluation of the impact of policies, is the issue of attribution.
Yeah.
And I wonder if you could comment on that.
I think you've raised a really important point. Some of the interesting evaluation work that I've seen lately has really talked about establishing a logic. So, you know, this is our older idea of a logic model. But the logic model really, the logic part of the logic model really has a purpose for us. So that if we establish that these are the variety of effects, and we think that there are various steps in achieving those final outcomes, that's really that stepwise breakdown is a way that we can begin to deal with the attribution problem.
Okay, great, thank you. Don't know if there are any other new questions. It looks like we still have a small audience left, so with that, maybe we can wrap up then. So, Catherine, I'd like to extend my deepest gratitude for being our first guest speaker on this new series of NRC roundtables for our broader audience base, and it was a great presentation. Thank you so much. I really appreciate your time, expertise, and contribution, so thank you.
Thank you.
And thank you to all of you for participating and for staying online. I really value your questions and your interest in this area. And we look forward to having you come on board on our next rounds. And if you have any questions on any of today's updates that we had given on NRC, you can always forward that over to Ashley or our general listserv information line, and we will definitely follow up. It looks like, did someone? No? All right, so thank you all, and have a good remainder of the year. I don't think we have another round series until next year. Thank you.